to metastasis. Metastasis can be intrahepatic metastasis and extrahepatic metastasis. Intrahepatic metastasis is spreading in the same site first and then to other sites. And also portal vein tributaries play a major role in this intrahepatic metastasis. They can be blocked by embolus and portal hypertension may be created. And talking about the extrahepatic metastasis, like other cancers, it can be via blood, via lymph, direct metastasis. Just like all the other metastasis cancers, they via blood, liver tumors, liver cancers, metastasis into lung, brain and bone. Other than that, adrenal gland can be metastasis. And via lymph, the lymph nodes around the liver, para-aortic, splenic, supraclavicular, because from all GI tract malignancies, metastasis can be happen in supraclavicular nodes, and pancreatic. The pancreatic, splenic and para-aortic is very near to the liver. Direct metastasis can be to peritoneum for the adjacent structures, peritoneum, lesser curvature of the stomach, diaphragm, transverse colon, all to the adjacent structures. Here are the symptoms of hepatocellular carcinoma. Right hypochondriac or epigastric pain can be there. We should remember the pain is dull, continuous ache and can be radiate to right shoulder. Dull, continuous and can be radiate to right shoulder. Right hypochondriac or epigastric pain. And digestive tract abnormalities, generally poor appetite, early satiety. Early, when we going to eat, we feel like we are full early satiety, abdominal distension, nausea, vomiting and diarrhea. And also as a result of tumor, compression, ascites, hepatic failure, liver failure, generalized swelling of the abdomen can be seen. All the other three symptoms are common to all other malignant tumors. Just like systemic findings of a tumor. What are those? Cachexia, weight loss, malnutrition, weakness, fever, systemic findings of a tumor. There's nothing to remember. All we know or want to remember is these two. The next one, paraneoplastic syndromes. They are also same for all malignant tumors. And manifestations due to metastasis. We know the places where the metastasis can happen, so we can easily understand this. If it goes to lung, cough, dyspnea, hemoptysis can be seen, and pleural infiltration, chest pain, dyspnea, and pleural effusion in right side. Because pleural effusion, the pleural infiltration can be happen directly. And bone pain and sudden paraplegia can be seen. Signs or the clinical features of HCC. The first one is hepatomegaly. Firm or stony hard liver. Surface is very smooth or irregular or maybe frankly nodular. And hepatic tenderness can be there, markedly raised right hemidiaphragm because of the hepatomegaly, and epigastric lumps can be palpated. Splenomegaly And ascites, we should remember the color can be yellow or blood stain in color. And jaundice, other symptoms, the other signs, just like arterial bruise and friction rub. Friction rub is that when we hear the lung sounds, we can hear friction rubs. These are the clinical stages. We can classify into clinical stage 1, 2A, 2B and 3. You can read it after this video. When we're talking about the complications, hepatic encephalopathy and GI bleeding is very common. And secondary infections also very common because of the inability of liver function, the immune compromisation, pneumonia, infection of fungus and virus is very common. Tumor rupture is very rare, but it's also an emergency and deadly condition. When going to diagnosis of liver tumors, the hepatocellular carcinoma, we can choose one of these lab findings: alpha-fetoprotein, gamma-glutamyl transferase, this gamma-carboxyprothiombin, and alpha-L-fuconoside. These are specific lab findings for HCC. Other lab findings like ALT, AST elevation, bilirubin, and total protein and albumin decrease, blood cell count can be useful. The imaging findings for the HCC: ultrasonic examination, USS. The mass more than 2 centimeters can be diagnosed, and CT and contrast enhanced CT, magnetic resonance image MRI, hepatic angiography, laparoscopy and biopsy CT can be used. The diagnosing criteria, there are 3 main diagnosing criteria. Criteria 1, AFP, alpha-fetoprotein, over 400 microgram per liter, and excluded false positive, because AFP can be false positively high in some cancers like ovarian cancer, testicular cancer, like that. So we have to exclude false positive of AFP elevation. The criteria 1 is AFP over 400 microgram per liter, firm or stony hard enlarged liver in examination, and imaging result, 1 imaging result. Criteria 2 is AFP below 400 micrograms per liter, and also exclude false positive. 2 kinds of image results, because AFP is below 400, and or two kind of imaging results, or 2 specific tumor markers positive, just like what we discussed here: alpha-fetoprotein other than AFP, gamma-glutamyl transferase, this carboxyprothiombin, alpha-L-fuconoside, like that. Criteria 3, obvious clinical manifestations of HCC, documented extrahepatic metastasis, and metastatic hepatic tumor excluded. It means because in criteria 3, maybe it can be a liver lung tumor that metastasis into liver and shows obvious clinical manifestations of HCC. So we have to exclude that metastasis into liver. It's not a lung tumor that metastasis into liver. We have to find that it's a liver tumor metastasis into lung. When talking about the differential diagnosis, cirrhosis and hepatitis is the first one, and metastasis hepatic tumors, that means the secondary tumors of the liver, that means cancer from somewhere else in lungs or GI tract or anywhere, or breast, that metastasis into liver, and benign tumors or diseases of liver, just like hepatic adenoma, hepatic cyst, cavernous hemangioma, and focal nodular hyperplasia. And also we have to exclude hepatic abscesses caused by some pathogens, parasites mainly. Management. Finally, we came to the management part. So we can do a surgery for resection and alcohol injection. It's a specific treatment. Embolization or chemoembolization can be done, and generally chemotherapy, radiotherapy can be done, and also biological response modifiers can be used. And the definitive treatment is liver transplantation, mainly in a diffuse and nodular type HCC. That comes to an end of about HCC and liver tumors. Thank you very much.